Have you ever heard about uterine fibroids? Do you know what they are and how they affect women worldwide? These non-cancerous growths that appear in the uterus, often during childbearing years, are known as uterine fibroids. While they aren't associated with an increased risk of uterine cancer and almost never develop into cancer, they can still pose significant health challenges. Uterine fibroids are more common than you might think. In fact, about 3 out of every 4 women will experience them at some point in their lives. That's right, they're not a rare condition, and they can impact anyone, regardless of age, race, or lifestyle. Yes, uterine fibroids are a women's health issue, but they're also a community issue, affecting families, relationships, and quality of life. So it's essential for all of us to understand them, no matter our gender. Now that we have a basic understanding of what uterine fibroids are, let's delve deeper into this subject. So, what causes uterine fibroids and who is at risk? The exact cause of uterine fibroids remains a mystery, but there are theories. Some experts believe that genetic alterations, hormones, and substances aiding the body to repair the uterine lining might play a role. Also, it's thought that estrogen and progesterone, the hormones that stimulate the development of the uterine lining during each menstrual cycle, can promote the growth of fibroids. Risk factors? Well, they're numerous. Age, for instance. Fibroids become more common as women age, particularly during their 30s and 40s through menopause. Also, heredity. If your mother or sister had fibroids, you're at increased risk. Other factors include race, with evidence suggesting that Black women are more likely to have fibroids than women of other racial groups, and onset of menstruation at an early age. Understanding the causes and risk factors is the first step towards prevention and treatment. What are the signs that someone might have uterine fibroids, and what complications can arise? Let's dive in. Symptoms vary, but many women with uterine fibroids experience heavy menstrual bleeding, sometimes with blood clots. Periods may last longer than a week, and some women feel a pressure or fullness in their lower abdomen. They might also have frequent urination, difficulty emptying the bladder, constipation or backache or leg pains. Now, not every woman will experience these symptoms, and some may have no symptoms at all. That's why regular checkups are crucial. Complications, while less common, can be severe. Uterine fibroids can lead to reproductive challenges, including infertility, multiple miscarriages, or early onset of labor during pregnancy. In some cases, fibroids can also cause complications during childbirth, and in rare instances, they can lead to life-threatening blood loss. Being aware of these symptoms and complications can save lives. So it's vital to stay informed and proactive about your health. Are all uterine fibroids the same, and how are they treated? Great questions. Uterine fibroids are not all the same. They vary in size, location, and the symptoms they cause. There are 3 main types: submucosal, intramural, and subserosal fibroids. Submucosal fibroids grow into the uterine cavity. Intramural fibroids develop within the muscular wall of the uterus, and subserosal fibroids extend outside the wall of the uterus. Each type can cause different symptoms and may require different treatment approaches. Speaking of treatment, options range from medication to surgical procedures. Medications can regulate your hormones to relieve symptoms. Surgical options include procedures like a myomectomy, which removes the fibroids, or a hysterectomy, which removes the entire uterus. But remember, everyone's journey is unique. It's essential to discuss with your healthcare provider to determine the best plan for you. With knowledge and medical advancements, uterine fibroids can be managed effectively.